Missouri Attorney General Andrew Bailey announced that he filed a lawsuit against Planned Parenthood Federation of America for systematically misleading women about the damages of the abortion drug, mifepristone. In announcing the lawsuit, the AG's office noted how Planned Parenthood's false advertising has made dangerous claims, such as calling mifepristone, quote, safer than any other medicine like penicillin, Tylenol, and Viagra. So what's the truth when it comes to the abortion drug? Here to discuss this with us and more, live from SoConCon, are David Bereit, Executive Director of Life Leadership Conference, and Dr. Christina Francis, CEO of American Association of Pro-Life Obstetricians and Gynecologists. Dr. Francis, welcome to Washington Watch. Once again, thanks for being with us. David, welcome.
It's great to be here.
All right, so let's start with Dr. Francis, is the abortion pill just like taking a Tylenol?
Oh, goodness. Nothing could be further from the truth. And that's why I was so excited to hear about what the AG did in Missouri. Certainly we know that the abortion pill is never safe for my preborn patient. It leads to the death of my preborn patient, but it's also not safe for women. And these continued claims that it is safe, safer than over-the-counter medications like Tylenol, are not only misleading for women, they're dangerous. Women are taking these drugs, these very high-risk drugs, without realizing the true dangers that they're facing from taking these drugs. And these dangers are not hypothetical. They are complications that doctors like myself are seeing on a regular basis in our emergency room, seeing women come in with heavy bleeding, infection, and many other kinds of complications.
Has there been an increase?
There definitely has been an increase, yes. There was some recent data that came out that the Ethics and Public Policy Center looked at some insurance claims data, so looking at real-world use of these drugs, and that showed that 1 in 9 women now face a serious complication after they take these drugs. And I was being interviewed by another journalist who asked me if I was surprised by that finding, and I said, actually, no, because it's consistent with what I see.
David, one of the problems we have is the reporting requirements. This information is just not being collected as it should.
It's absolutely correct. And there have been, since the FDA approved the drug, and they had the claim that less than 0.5% of the people who used the drug had a serious adverse event. That was also in the accelerated Clinton approval of the drug, which rushed it through approval to get it to the market. Right. And so what we're seeing now, this data that Dr. Francis is referring to, is 22 times higher than that. But because in the Biden administration, they continue to roll back protections for women who are administered these drugs, we don't even have the data from the typical reporting agencies. And so insurance claims data, 865,000 uses, prescriptions of abortion pills have been reviewed and analyzed from all traditional pay insurers as well as Medicaid, Medicare, TRICARE. And that's where they found all these complications. 10.9% of those who take the abortion pill using the FDA's own adverse events reports are seeing these complications. So this hasn't been reported elsewhere. Now that this data has come forward, that's why we need to champion this to Health and Human Services, to the Food and Drug Administration, to make sure that they not only look and say, how do we restore the regulations that were there at the beginning, but ultimately look at why was this drug approved in the first place, and now that we have more data, can it be removed from the market? And it should be removed from the market.
So, Dr. Francis, let me ask you this question. Because the current FDA policy it does not require in-person consultation, and the Comstock Act is not being enforced, so these pills are being mailed into states, far away from a physician. Are you pretty confident that these numbers are underreported because people are not necessarily going to come in and say, I took the abortion pill? They might say that, I'm having a miscarriage or something else.
Oh, 100%. We know that these are underreported. As you stated, the FDA under the Biden administration lifted that one last in-person visit that was required for women to obtain these drugs and was necessary, honestly, for women to receive fully informed consent about the risks of that drug. Now, as you said, they're being mailed from all over the country, even from other countries, into even states where abortion is illegal.
When we're so concerned about, the drugs coming across our southern border, and how we don't know what some of these drugs are coming in from China and other places. I mean, really, we're going to allow people to be mailing these things through the mail with no contact with a physician?
Right, absolutely. You know, the abortion industry likes to claim that abortion is healthcare, and yet they don't want to be regulated as the rest of us in healthcare are regulated. And this really is medical malpractice, the way these drugs are being dispensed to women with no interaction with a medical professional whatsoever.
All right, so I'm going to make a statement here. I've made it before in this program, but David, you made reference to this, that this policy, this current policy was put in place during the Biden administration, and it's still in place.
Right.
But it could be changed by the FDA.
It absolutely can, and it should.
Okay, so let me play a clip of Dr. McCary, Dr. Marty McCary, who is the FDA commissioner. This was Tuesday, July the 22nd. He was on MSNBC's Morning Joe, and he was asked about the abortion pill. I want you to hear his response. We want to play clip number 5, please.
We can't turn a blind eye to what's happening with safety signals with that drug or any drug. So that evaluation is ongoing.
But is it still true for you that you have no plans to take action on changing access to that drug?
That is true.
So he said, you know, we need to look at these things, but he says, I have no plans to change access to this drug, which is totally uncontrolled. There's no restrictions basically on this drug. In states like Louisiana, Texas, and about a dozen other states that have strong pro-life laws, those laws are being totally sidestepped by this abortion drug. I mean, this could be changed overnight by this administration.
Absolutely.
So let's talk about abortion numbers, David. I know you track this.
Yep.
After Dobbs, there was a short-term immediate drop in abortion. It was about according to the abortion industry, about 930,000 abortions. We're now over 1 million in the last 2 years. An increase in abortion. And we're hearing all this about people don't have access to this. The abortion pill is behind that, is it not?
The abortion pill is central to that. When you have the abortion industry research arm, Guttmacher Institute, saying that this was in 2023, 63% of abortions are now committed by abortion pills. I was just recently in Des Moines, Iowa. 90% are done by abortion pills, abortions, because the Iowa legislature has tried to enact protections for women and children. Columbus, Ohio, it's 85%. So that is leading to so much of this. And the pills, as we talked about, are being mailed from all over the place with no protections. This is a health crisis. Yeah. And now that we know the pill has all these additional complications and the providers don't care about the safety and health of women, they don't even many times require any physician contact. They don't require any proof of pregnancy. You don't even have to provide information saying whether you're male or female, and they're just mailing these pills out. If you have money, they'll send a pill. And that's why we're seeing the numbers go up, as well as traffic across state borders. I was recently, Tony, in Texas, and I was sitting at a banquet, a pro-life banquet, and a woman shared with me, I've retired after the Dobbs decision because Texas protects children and abortions don't happen here. But I had the data knowing that more than 36,000 women had crossed the borders to other states, primarily New Mexico, to have surgical abortions, and more than 34,000 abortion pills had been mailed into Texas. So these states that are passing laws to protect life, 70,000 children are dying.
That's the irony here, even of the current administration, that says they support the effective Dobbs, allowing states to protect women and the unborn, but yet the federal policy still in place does the exact opposite. In fact, I was talking with Jonathan Saenz, who's here at the SoConCon from the Texas Values, and in the special session there in Texas, the governor has a bill in there to try to strengthen control, or at least ability to sue after the fact, those that traffic in these abortion pills.
Mm-hmm. Absolutely.
How widespread is this across the country that you've come across, Dr. Francis?
Well, as David said, we know that the abortion pills now account for the vast majority of abortions in this country, including in states like here in Indiana. I'm a Hoosier. In this state, we passed a good law that protects women and children from the harms of abortion. And yet, in my practice as an OB hospitalist, our group still sees on a regular basis women coming into our emergency room with severe complications related to this drug because they're they're able to obtain them online. And I think it's really important for people to understand how truly dangerous this is. The farther along in pregnancy a woman is when she takes the drugs, the higher her risk of emergency surgery. They're not ruling out ectopic pregnancy, which is life-threatening for women.
Originally, this bill, the pill was designed, was it not up to 7 weeks in the pregnancy?
The original approval was up to 7 weeks, and part of the reason they chose 7 weeks was because the study showed that starting at about 8 weeks, the risk of complications increased exponentially. Unfortunately, under the Obama administration, they then expanded that to 10 weeks of pregnancy.
But how do you know whether someone is 7, 10 weeks when you're signing a prescription or sending these pills through the mail from, like, we've got cases in Louisiana where our Attorney General is suing a doctor in New York that has sent the pills into Louisiana. I mean, how does that doctor know whether that woman is 7 weeks, 10 weeks, 12 weeks, 15 weeks along?
Yeah, the doctor has no idea. And the woman, in fact, may not actually know how far along she is. And this destroys informed consent for women because a doctor cannot possibly discuss her risks unless they know how far along she is. You know, all of these things that we've discussed are the reason that led APLOG to lead a letter from 6 medical organizations representing 30,000 medical professionals to HHS and the FDA, urging them very strongly to take into account this new data about the complications and to take a look at how this is being dispensed, the harm that it's causing for women, and to put back those original safeguards, to pull that use back to 7 weeks and ensure that women have ongoing care if they are going to take these drugs.
Now, I think, Dr. Francis, when that letter was sent, they indicated they were going to look at the studies. Have you heard any further information from the FDA?
We have not, although we have been told that they will take a look at the data and will take that into consideration. And, you know, I think it's very important that people understand no matter where we stand on the issue of abortion, no matter where someone stands, they should care about women not being treated like this. Right. And the bottom line is the FDA right now is not doing its job when it comes to protecting women in this country.
Well, that's totally true. No question about that. I mean, they are once again sacrificing the well-being of women for a political, ideological goal. But David, I would say there's another side to this, and that is what we talked about just a moment ago, is that the recognition that the states have a right to protect women and children. I mean, we saw that in a recent Supreme Court case when it came to gender transitions and gender treatments, that the states have a right to set a standard.
That's right.
This is totally being undermined by the federal government. Now, I know the abortion industry is exploiting it, but it's the federal government that's opening the door.
Federal government. And I think, Tony, to your point earlier, this is why it's so important that whether we live in a red state or a blue state, something we can all do to make a life-saving impact today is contact Health and Human Services, RFK Jr.'s office, and say, this pill must be investigated. You have the additional data. Do your job. Protect women. And then to Dr. McCary and to the FDA, the same thing. Communicate to them. They will act when they feel the heat.
Yeah.
And that's what we have the responsibility to do.
And that's what the SoConCon is all about here, is advocating for these values that make America strong. You know, we hear all this about making America great again. I want to see it great, but the pathway to greatness is goodness first. And I think nothing is more important than protecting women and unborn children. And folks, you can weigh in on this. Text the word LIFE to 67742, LIFE to 67742, and you can sign a petition that we're going to take to this administration, encouraging people to stand this administration to stand on the right side of this issue and protect women and children, and the right of states to do the same. Dr. Francis, I'll give you the final word.
All right. Well, you know, I would just echo everything that's been said here to just emphasize how important it is for people to realize, especially women who might be contemplating an abortion, to realize the true dangers that exist with this drug. Again, obviously for their preborn child, but also for them. And as you said, every American should be invested in ensuring that if the FDA says that a drug is safe in the way that it's being dispensed, that it is actually safe. Yeah. So I would encourage people to sign your petition, join us in asking the FDA to ensure that there are appropriate regulations around this drug.
Dr. Francis, thank you. David Bereit, thank you for your leadership and your passion on the life issue. Always great to have you on the program.
Great to be back.
And folks, let your voice be heard. Sign that petition. Text the word LIFE to 67742. That's LIFE to 67742. And take a stand. This is a moment in which we have an administration that is right on most things, and they should be listening to us, and they will. But you got to speak up. So text LIFE to 67742.